Years old man sustained distal radial fracture during game of the rugby. Imaging shows a comminuted fracture with involvement of the articular surface. What is community fracture? Comminuted fracture. Comminuted fracture when fracture segment is more than two. What is the most appropriate definitive management? So a patient suffering from the distal radial fracture, which is comminuted, that means the multiple fragment present, and it involved the articular surface. What is the managing option? Here the options are open reduction and internal fixation, reduction under anesthesia and place a plaster cast, reduction under hematoma block and place into plaster cast, place onto a skeletal traction system, apply futura splint and review for fracture clinic. So first of all, let's see, this is different type of fracture. The first two is the extra articular fracture, and in case of extra articular fracture, here we can see it don't involve any type of articular surface. This is the articular surface of the radius ulna. Here we can see the articular surface of the radius, actually the articular surface of the radius. So there is no involvement of the articular surface. On the other hand, the third and fourth picture, here we can see this is the articular surface and it is involved by the fracture site. Here this is the, as this is the articular surface and the fracture line, it involved the articular surface. So the management between these two, that means the extra articular and the intra-articular, are totally different, because the intra-articular fracture, they are delayed healing, non-healing, non-union or malunion develop. So in case of the, when there is intra-articular involvement in this situation, the scenario or management scenario is different, because in within the joint there is the fluid, different type of fluid present. Actually this is the, as the synovial fluid present. So in this synovial fluid area, the fracture union usually delayed. So the distal radial fracture, it is, in short, it is the most common, and it is occurs due to falling on outstretched hand, and elderly female are most commonly suffered. Distal radius fracture occurring about 1 centimeter proximal to the wrist joint with dorsal angulation of the fracture fragment. So what is distal radius? Distal radius, it means about 1 centimeter proximal, about 1 centimeter proximal or up to 1 centimeter proximal of the wrist joint. That means the 2.5 centimeter. Management usually conservative and reduction. So this type of fracture, that means when a patient falling on outstretched hand and there is a dorsal angulation of the fracture, so in this condition usually the distal radius may be managed conservatively. And the fracture involved, name of the fracture usually Colles and Smiths. So this name also important, the Colles and Smith's fracture. So these two are important. Fracture occurs in the distal radius and they are managed conservatively. On the other hand, distal radius, the potentially unstable injury may be managed by surgical fixation. So when surgical fixation requires of a distal radius fracture, when there is the unstable joint or there is multiple fragment, so the stability not achieved. Factor favoring instability includes dorsal tilt more than 20 degree, comminuted fracture, injury to the ulnar styloid, intra-articular disruption. And in our question, there is comminuted fracture, number one. Second one is the articular disruption or joint involvement. And as this 2 point present in this question, so our treatment option will go for the surgical option. Young patients who typically have higher energy mechanism injury are usually managed surgically. So in young patient, usually there is less chance of the fracture and usually not fracture occur, and only fracture occurs in the distal radius by a high velocity force. So when there is a high velocity force, there are usually multiple area of the bone are fractured. So in this condition, there is no option for go through the Conservative, in this case we should also go for the surgery. In elderly, it is important to initiate treatment for osteoporosis. So in elderly, especially in female, we should go for the treatment of the osteoporosis, including the fracture management. So what is our option, as it is the community fracture? Second one, it is involvement of the articular surface and it is unstable, so go for the surgery, and the surgery is open reduction and internal fixation. And other option here are all the conservative management, and we should not go for conservative management for a fracture who involves the articular surface of the joint.